Career as a musician, international business, started international business in 1988, and then I spent 20 years, more or less, because I was based in Asia, in India, studying and researching, and it's just been my honor. Now my life is a little more my own. I can come back to the States, and I've just been blessed for 1 year now to be the resident of the Las Vegas Ramakrishna Center, and the vice president, resident. And we're really growing, having an amazing time sharing these important understandings in our world today that's suffering so very badly. And now is more than ever needed some understanding of unity, which was really the center of the idea that's coming from India. And we thank you so much for that, for all of you here. So our first speaker today is a very esteemed reverend from Swami from the Ramakrishna order, Swami Vardhananda. And Swami Vardhananda ji was joined the order in 1973. He took sannyas to become a monastic Swami in 1982. He's always been in Chicago after that. So we have our treasurer here in Chicago. He's in charge of the Homer Glen Center, and he'll have our opening speech from Swami Vardhananda ji.
Good morning and welcome. Very happy to have you here. The Fall Banquet is actually our only formal fundraising event of the year. And this is the first time we've been able to hold it in about 3 years because of COVID. And so we're very happy that you could rejoin us now. You know, during this year, we began to do our classes also in person, in addition to online, and people started coming again. And now here, we're very happy that you could all join us together as part of the Vedanta community here. Like I said, we are going to present a very good program this time because we live at a time when it's very difficult to get accurate information about anything. Everything's become politicized. There are whole websites devoted to conspiracy theories and all kinds of false things. So it's very hard to really know what's going on in the world and in the United States. So this time we have 3 speakers who will speak on different aspects of life in the United States after COVID. And first one is Dr. Dulal Baumik. He will speak on what's going on in the economy now. There's all kinds of things on the internet about disasters going to come to the economy and things. So he's going to speak on what's happening in the economy. And he is the director of the Biostatistical Research Center at UIC here in Chicago. And then secondly, Dr. Rajni Padwari is going to speak about what is the status of COVID now. You know, everybody's assuming that it's gone away, it's passed, but I think there are still cases coming. So she is going to clarify what actually the situation is with COVID now. And she is the Director of Medical Services for the Trinity Services Incorporated. And then finally, our third expert, Swami Ishadmananda, who would speak on the impact that COVID has had on the spiritual life in America, in Chicago. And one thing, in some ways, actually COVID was a kind of a blessing in disguise. Because of COVID, we started having all our programs online. And instead of reaching 20, 30 people in the shrine, we reached like thousands all over the world, 2,000-3,000 on an average, I think. We're getting all over from our online appearance. So it's the good and the bad. And so we also have today, we have some very interesting musical entertainment from the Chicago Immigrant Orchestra. And it features both bhajan singers from India, as well as a Mongolian throat singer, a Taiwanese buan, and a Latin percussion. So a variety of music from all over the world. That will be going on today. And so let me just quickly run through. Most of you have probably received, I would hope, a copy of the program for today. But let me just quickly run through it. At 11:15, or now it'll be, I guess, 11:30, there'll be a music performance by the Chicago Immigrant Orchestra. Then after that comes the economic impact of the pandemic, a talk by Dr. Dulal Balmek. Then an appeal, and then finally another musical performance by the Chicago Immigrant Orchestra. And then Dr. Rajni Panwari, she will talk about the impact of the pandemic on healthcare. And then we have lunch at 12:35. Then at lunch will be followed at 1 o'clock by another music performance. And then Swami Ishatmananda. At 1:15, Swami Ishatmananda will speak on the spiritual impact of the pandemic. And then at 1:35, we have the grand finale with the Chicago Immigrant Orchestra. So as I mentioned, that in some ways, the COVID, it actually kind of helped the Vedanta movement in the sense that it spread to a much wider audience than it used to have. And so hopefully it will continue with that. So I thank you. I welcome you all. We're very, very happy that all of you could come with us and join with us today. And thank you. And now the Chicago Immigrant Orchestra will do their first music performance. No, wait.
Well, as Swamiji was going to mention, we will start with the Chicago Immigrant Orchestra, but we wanted to kind of give you some information on the amazing history and some of the experiences of our musicians so you can appreciate more of exactly what they've been through to get to us today. The first performance is going to be a combination of Hitesh Master, and Hitesh was born and raised in Nandia, Gujarat, and has been training from age 3 and gave his first performance at age 6. His gifted talent for music has been has been passed on from generations, going as far back to 1417, when his forefathers were designated royal singers in the Rajiv Parvir. I'm so sorry if I mispronounce these things. He has 4 gurus from whom he has learned Hindustani classical and harmonium. He was also associated in Bollywood for 12 years, working with well-renowned musicians Shankar Jagashani. Hitesh Master is now based in Chicago, teaching and performing music. And also, Greg Nirgar is going to be playing on this first piece. He's a bassist from Chicago. And Greg has performed locally, regionally, and nationally, and internationally with ensembles such as the Surabai, the Right Now, Solio, Yves Francois, and Ramboto Jazz, J.C. Brooks Band, Annie Harris, Las Guitarras de Españas, and many others. You're tricking me on the names today. And also Tamir is going to perform with them. He is a world-class and award-winning performer of Mongolian and Tavian music. Now based in Chicago, Tamir is from the far northwestern region of Inner Mongolia. He received his master's in music in world music, performance from Northern Illinois University in 2017, and received his undergraduate degree from Inner Mongolia University Arts College with a specialty in throat singing. And I won't even try to pronounce that part. So we'll leave that to our wonderful performers. Thank you.
Who is the lead? He's the lead. Yeah, who is the lead? Who is singing?
I'm singing.
Yes.
sound from that one to the bass mix will sound will come.
It will come. Yes. Put it on. Come. Fix up quite a lot. Yep.
Okay.
Just.
जग में सुंदर है दो चाहे कृष्ण कहो जग में सुंदर है दो नाम चाहे कृष्ण कहो या राम जग में सुंदर है दो नाम चाहे कृष्ण कहो या राम बोलो राम 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 बोलो श्याम 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 बोलो राम 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 बोलो श्याम 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 जग में सुंदर है दो नाम चाहे कृष्ण कहो या राम जग में सुंदर है दो नाम चाहे कृष्ण कहो या राम बोलो राम 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 बोलो श्याम 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 बोलो राम 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 बोलो श्याम 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 हृदय में प्रेम बढ़ावे एक जाप संताप मिटावे एक हृदय में प्रेम बढ़ावे एक ताप संताप मिटावे दोनों सुख के सागर है गमाजानी सारे गा दोनों सुख के सागर है दोनों सुख के सागर है और दोनों पूर्ण काम चाहे कृष्ण कहो या राम जग में सुंदर है दो नाम चाहे कृष्ण कहो या राम जग में सुंदर है दो नाम चाहे कृष्ण कहो या राम बोलो राम 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 राधिका के संग राजे, एक जानकी संग विराजे। गमधानी सारे रे सारे गगन सारे रे सारे 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 गा रे गा रे नी दा मा गा एक राधिका के संग राजे, एक जानकी संग विराजे। चाहे सीताराम कहो, चाहे सीताराम कहो या बोलो राधे श्याम, चाहे कृष्ण कहो या राम, जग में सुंदर है दो नाम। चाहे कृष्ण कहो या राम, जग में सुंदर है दो नाम। चाहे कृष्ण कहो या राम, बोलो राम राम राम, बोलो श्याम श्याम श्याम, बोलो राम राम राम, बोलो श्याम श्याम, बोलो राम, बोलो श्याम, चाहे कृष्ण कहो या राम, चाहे कृष्ण कहो या राम, चाहे कृष्ण कहो या राम। Thank you.
David? Okay. He's going to sing?
Wow, I am very delighted with it. That is amazing. And just to think, this represents so much of what the Ramakrishna order and what the world is eating. They come from different parts of the globe. I think you couldn't put them further apart. And yet they came today in such perfect harmony. They were just blessed. Wow, this is going to be a fun night today. That's the thing that happened. And now, as Swamiji was saying, we're going to have the topic is the economic impact of the pandemic. Okay, Dr. Bilal Bhamik. And Dr. Bhamik,
We can go.
I'll give you a little bit of his background as well, is a professor of psychiatry, biostatistics, and bioengineering at the University of Illinois, Chicago. He received his Bachelor of Science in Statistics from Calcutta University, his Master of Science in Statistics from the Indian Statistical Institute, and his PhD in the same field from the University of Maryland. Before joining UIC, he served as a professor of statistics in the Department of Mathematics and Statistics at the University of South Alabama.
Hold on, sir.
Thank you very much, Maharaj. It's my pleasure to be here and to give a talk on the global economy, telling the effects of COVID-19. I have divided my talk into two parts. The first component will be the early COVID, basically in 2020 and 21. And then, starting from this year, we'll see that the impact on economy is not only due to the COVID, but also the Ukraine war. So it's basically mixed up, and it's extremely hard now to separate out the effect of COVID on the economy. Rather, the Ukraine war is taking the main bulk of the downgrade of the economy. So we'll see how it is progressing, how the COVID-19 is eating down the growth of the economy, and then gradually how the inflation started, and then the war of Ukraine war is taking the main part of the economy down. What we see is that the main causes of the economy, as we see, is the public health crisis is there due to COVID, then severely affected the global economy, and a sharp rise in unemployment and disruptions in the transportation service and manufacturing industries. As we see, and probably we all can remember how the death toll in US was going up early in 2020, the death toll in different parts of this country, it sharply raised in mainly April and May. Then it slowed down and it again came back in July and August, September, the second part of 2020. But that picture is of USA. Now if we look at the death toll, the cumulative death toll in USA, the sharp rise on the top of that, and many other countries compared with countries, smaller countries like Germany, Italy, and so on. And that is the cumulative effect that we see on the top picture or the top figure of the USA. At the same time, what is happening in the economy? The gas price, which is the part B, the down figure, at the very down of that gas price, it went down, and with the stock market also we see as the year was progressing 2020 in July and August, all major stock markets in the world also went down. And that is a kind of indication is that the economy was not doing that well. In fact, was doing very bad in 2020. Now the facts about COVID-19, what are the main factors that were affected heavily by COVID-19? What we see that small business revenue, as will progress, the three pictures is showing the households have difficulty in maintaining the regular expenses daily basis. That is the top picture. And it was between say 30 and 35% of the US households, is it okay? Yeah, are not doing that great. The second picture or the middle picture is talking about how many percentage of households had problems or coping up with rents. And the last one was telling that about say 10% of the people didn't have sufficient food to feed the family. So all these three figures, the top one is the difficulty in regular expenses, then the middle one is talking about say 10% or 15% had problem with paying the rents, and about 10% had problems with regular food during the COVID-19 in 2020. And this picture is saying that the small business application went down heavily, especially in the economy went down, especially in the hospital. And the middle one is the overall economy down, industries. And the top one is saying that the transportation was also went down. These are a few segments of the global economy, especially this, now I am talking about US economy. And this one is the action of small business. As we see in the middle part here, let me see. This middle part is saying that it was down, this part was down during July, August or May, June, and then it slightly went up, and this is in comparison with other years. Then, now we are talking about the unemployment. The unemployment rate, actually it was a significant that we can see. It significantly went down at the beginning of COVID-19. That is the unemployment rate, and this is a kind of unemployment rate, but it is divided into two categories. One is the layoff, the unemployment due to, and the other one is shutting down of the industry or the factories or offices. So the total is the global impact, the total impact of unemployment during early COVID in 2020. This picture is also telling what was the total unemployment, and it has segmented into several components. Some people are looking for jobs, unemployment temporarily, unemployment permanently. This is unemployment permanently, unemployment temporarily, and people are looking for jobs. It is almost, we see that 4 times more than at the beginning of 2020 in January, February, and so on. In April and May, it went almost 4-fold up, the unemployment picture. The next one is talking about again the unemployment, but what surprisingly we see in the next picture is the savings of US households. Generally, saving is not that much, about say 10% or 5% in all over the years of the last 20 years. This is the kind of saving that we see, almost 5 to 10% like that. But in 2020, it went up to 40% or 35%. Now, is it good or bad, the saving of the economy? Well, for a particular household, probably it's very encouraging that they are saving a lot, but at the same time, the money is not circulating in the country or in the society. So as a result, the new employment or the expansion of the economy, the growth, it stopped. And people are more saving, no doubt of that. Now, what are the reasons for saving more? One reason is that people could not go out that much. There was no travel, almost shut down, stopped. People are not spending on what they wanted to do, not including in the restaurant and so on. So this is a kind of indication to the whole economy, how it was doing. It's just the reverse of the saving. Now we are talking about the share of families who are experiencing the food crisis. There are 2 types of family, with children and without children. Now, these are the ethnic group segmentation. In the first half, the violet color was families without children, and the greenish color was the families with children. Now we see that with children they are suffering more the shock of their income. They are suffering more across almost all types of ethnic groups: white, Hispanic, non-white, Asian, and so on. And the similar picture we see when we divide the income by different amounts, say 25,000 to 35,000, and the last one is 200,000 to 250,000. So the impact on food, this is basically the food or the shop, we see that the families are not suffering that much, either they have children or no children. But for low-income families with children, they are suffering much more than without children. So this is a kind of indication that the lower income families not only was suffering, but it depends on their children. Children, they require more food or more income, which they are not getting. Now, the same indication that we see across different ethnic groups, the black, Latino, white, and so on. And what we see here is that the down one, which is the Asian group, was not doing that bad compared to other groups. But both Hispanic and the black communities, they are if they are more affected due to the pandemic in 2020. And this picture didn't change that much in 2021 and even now. So all these ideas that we are trying to get, it was in 2020 and 2021. In the beginning of this year, which is 22, it got changed. So it got changed, and let's see what is going on. Now the war got started. And this is the Ukraine war, a small country close to Russia, and tremendous impact on the world economy. So before we are talking about the impact of COVID-19 on the global economy, impact of COVID-19 on the global economy. And now it is confounded by the war. So what is happening, we cannot separate out the reasons or the downturn of the global economy. It is not only due to COVID, but also the war is playing a role. This is called a kind of confounding effect type of thing, that more people are displaced and the COVID may have probably spread out. So it has an impact on COVID, and it has an impact on the global economy also. On the top of that, as the COVID is not eliminated out, so still its effect is continuing. So the global economy now is mainly affected by both the war and the COVID-19. And this is McKinsey's study. This is a kind of survey. People in different countries are asked how much the economy is being affected and what do they think. This is a survey data. Most of the countries, they are saying that this is due to inflation. The top one is due to inflation. As we can see, it is about 30%, 50%, 60% and so on, except China, who are thinking that still COVID-19 is the main reason for the bad economy. There are other factors are there. For example, volatile energy, which you can see the countries are not getting that much from Russia, which are depending on Russia, so the economy is rising. And the inflation is there. Inflation is the big cause. Then supply and demand problem is still there, and labor shortage is of course there. So if we ask now, what are the causes for the bad economy, then it is not only COVID, which is the down one, but also inflation and many other reasons. Those reasons are there, but now they are very much prominent for the bad economy, in fact, in 2022. And this picture is saying that this is a kind of world picture, and the inflation is again that started. Inflation is not a new thing in 2020. Inflation was there, but this year we see the price has gone up tremendously. Demand was there and people had money at the beginning. So the price went up because to meet the demand, and if it goes like that way, then the common people or the poor and middle class people will not be able to cope up with the inflation, with the high price. So it was going on there. And this picture in other countries showing the top one is the US economy, the US, and the down on some other countries like Italy and so on, and it is going the same way. Now the conclusion is that what should we do or what can we do? We cannot do that much, but there are many reasons for bad economy, and this is again McKinsey's study. The global economic activity is going through a broad base and sharper than expected slowdown, that we can see. And still there are about maybe 7 to 9% people are looking for, maybe around 5% people looking for jobs. Many factories are still has been shut down and have not opened, and many different types of jobs have gone out and not coming back. The cost of living crisis is continuing. The food crisis is a severe crisis here. the Ukraine economy, sir, the global growth from this year to next year is about 3%, will be 3%, and then eventually it is going down maybe 2% next year and so on, which is far below than expected. The global inflation is also right now maybe 6% or 8% and expected to be little slowing down next year to 6.5% and 2024 maybe 4%. The monetary policy should be restored, price stability that we already see. The federal government has, federal bank has raised the interest rate now maybe for home it is close to 7% and expecting that the inflation will go down or the craziness for buying homes and so on, other things will go down and eventually the economy will be better off. And that is the picture of US. I don't know what is happening globally. Fiscal policy should reduce the cost of living pressures. We are hoping, but what I feel that as long as the war will continue, it is very hard to predict what will be going on or what is the in future waiting for us. But we are hoping that it will go down, all types of inflation. Now, thanks to many organizations, IMF, World Bank, McKinsey, our Vedanta Center for giving me an opportunity to talk, and I have consulted many papers and other economic organizations also in the world. Now, this is my presentation and thank you for listening to me. Any questions? Any questions? Please feel free.
What was the interest rate that you mentioned?
It's interest rate for buying home that it is close to 7% for 30 years. Close to 7%. Okay, yeah, that is true. Government bonds 9.2 or 3%, but I am talking about common people when they are planning to buy a house and going for 30 years loan, that rate is close to 7%, maybe a little less or more, depending on what is looking for. But yeah, government bond that is close to 9.3% as of yesterday. Any other question? Okay, thank you.
So now we know the sky is not falling, right? So we're a little more relaxed, we can have lunch. Now we'll start, we're going to do an appeal for the reason why we're actually here. I'd like to invite up Sumit Ray. He's an engineer for 30 years. He's works and serves in the Homer Glen Vedanta Center, and he's really helps Swamiji, Swami Shatmanandaji, in many of his projects. So a special welcome to Sumit.
Thank you, Jeff. Thank you, everybody, coming here today. It's an awesome day. As Swamiji said, this is the one time we do the fundraising in the year. I want to show you in summary. You already know what we do in Homer Glen. So look at this picture there. It's so beautiful. And this all happened, all your donations money. We moved here 2008 from Hyde Park. So slowly we're improving here, and more people are coming. And I'll show you, and most of you know already. Oops. This is our shrine in the first floor, the main shrine. We do puja and regular services here. This is the Sunday service at the same place the Swamiji holds there, and also the weekly classes. The capacity of this area is 250 there, and there is some room for expansion in the future as well. This is our exhibition there, just outside the shrine. Here you can see the Swami Vivekananda right from the beginning, the route he came to Chicago, and different places associated with him. The places he stayed there, he lectured there, and all other things. So beautiful exhibition. If you have a time, please go and visit that as well. This is our first floor, the entry when you get in. This is our dining hall and the lobby area you can see there. This is our bookstore in the first floor as well. And we have not only books, all the CDs, DVDs, and other articles as well. This is our dining hall. After the pujas, we go here. It's prasadam. You can see that a lot of people come here on a regular basis for the pujas and other services. This is the basement. We completed the basement, I think 2014, where we finished the basement. And here we have 250 people sit for our pujas and other gatherings as well. So that is the example where we do the Durga Puja, Kali Puja, all other big festivals are happening here in the basement. So in the basement we also have guest rooms. We have 5 in the basement and 2 on the upstairs, so 7 total guest rooms. So any guest can come and stay here for the retreat, for pujas and all other spiritual practices. And each guest room has their attached bath, and we have also a dorm style room as well. Now, this is the house, we call it a Holy Mother's Cottage. This house is very old. It came with the land when we purchased this land, 15 acres land, we bought that time. And I'll show you the map, then you can see here. You can see on the right hand side of the picture, that's your the Lemont Road. When you get in, this is our temple, and south of that you can see Holy Mother's Cottage. So this cottage, we haven't done much work till we bought it. Their home, that cottage has 4 bedrooms on the first floor and 3 on the second floor. So the cottage is so old, it didn't have any water. It has a well, septic system. 2017, when the city of Lockport, they bought the water line close to our site, we took that, I don't know whether it's, doesn't work. So we extended the water line to our main temple. So we have a water line in the main temple from 2017. And at that time, we also engineered or sized the piping. We knew that it's going to happen in the future for the Holy Mother's Cottage as well. So right now, as we speak, we are planning to extend that line, water line, from the main temple to the Holy Mother's Cottage, the dotted blue line. You said from here, it will go dotted line to that Holy Mother's Cottage. It is around 230 feet long, 2-inch pipe going to be there underground, so we are in process of doing that. So the good thing is that all our main and the valve and everything teed up for that already. That we did in a phase 1. So here only the extension of that line. And you can see there is around $30,000 cost for that, and we're going to start that very soon. It's already approved. We are going for the permit right now, and then the work will start. And then also, in addition to that, we are adding 2 more bathrooms in the Holy Mother's Cottage. As you can tell in the table there, the first floor has 4 bedrooms and just has only 1 bath. It's a hall bath. It's not enough for the devotees when they come here, and mostly our devotees live there, older devotees. So we are adding 1 more bath in the first floor and 1 more in the second floor. Both are hall baths, so all devotees can live there comfortably. So cost for that is $16,000. So that's what our appeal is for now, to upgrade the Holy Mother's Cottage. That's all I have. Any other questions? All right, thank you so much.
Now we're going to have the pleasure of some more music, but before we do, we actually missed a few to introduce, so we want to make sure we don't miss you now. The first one is Tzu-Tsen Wu. As you can see, she was playing in the beginning too. A native of Taiwan, plays a variety of plucking instruments, specializing on Chinese ruan and luqin. I'll get it. She is currently a member of the Chicago Immigrant Orchestra. She is also a music educator and currently directs the Chinese ensemble of University of Chicago and has co-authored a children's music textbook commissioned by the United Arab Emirates Ministry of Education. Wonderful, welcome. And we have a new musician. One? It looks like he's a percussionist. Yeah, I guessed right. Hopefully we'll get to learn something about him, and I can tell you in the next break. Welcome again.
Hello everyone, I'm Susan, and I'm going to play a solo tune on this instrument called ran. And ran is a traditional Chinese instrument, and as you know, Chinese music is not a term of genre, but a big terminology that covers the 55 to 56 ethnicity in China. And the tune I'm going to play today, it's from the west side of China. And as you know, the west side of China is the connection to India and also the Middle East. So the music over there, the ethnicity over there, minority, they have their music skills that being influenced by Makam and Raga. And you'll hear a little bit right now soon. Okay.
The next song will be some Mongolian horses. All the songs mostly I'm singing are the traditional Mongolian folk songs, mainly all about horses. The previous song was mixing together, it's a fast horse. This one is another horse, it's a group of horse, APM.
little bit more with the Lisa's right over here.
Thank you. And thank you everyone for being here, spending your precious weekend hours with us, but for a good cause. Now, what an eclectic performance we are listening to. As we are spending our time here enjoying the event, we don't want to forget the reason we are here. But I know I'm standing between you and lunch, so I'm going to be brief. We got to focus on our objectives. We have here a very modest goal of trying to raise 100,000 for the event and for a good cause. But from what I have heard, what Dr. Baumig said and other speakers have been talking about, there's a few things are very obvious in today's world. That we are amidst very high inflation, and that's not going to go down very quickly, no matter how hard the Federal Reserve is trying. The second thing is, despite the downturn and despite all the hardship that generally people are feeling, or some of the people are feeling, savings rates are still high. Now, if you put the two together, inflation is high and saving rates are high, the value of your savings is going to go down in the coming months and years. So what better than to put it to good use for the projects that Vedanta Society has? And you have seen some of those projects. So let's get on with trying to donate to the event and the cause. And I'll tell you the logistics to go about it. You can write check. You can put Banquet credit card outside, or if you don't have any of those right now with you, you can just put your name down in the front, and there is Sandeep and Anu sitting at the front desk. They'll take your name and phone number down, and you can contribute later as well. But just to kick it off, we have more than 10 tables. It looks like we have 12 tables, and our goal, modest goal of 100,000 is not even 10,000 per table. So let me kick it off by saying what I just got from a few people right now and see where we are. Preeti and I are starting off with contributing 3,500 to the event. And we also have Moni Rengutanda donating $1,000. We have Hrishikeshji donating $1,000. And we have Dr. Prabhakar Joshi donating $10,000. So we are already off to a great start, and let's just give it a little push, and we will get there in no time. And thank you. Enjoy the rest of the afternoon.
We thank everyone who gives to this cause. As you can see, bringing people together like this and this cause of the Vedanta Society is at the heart of what's really needed in our world today. So we're going to continue with the healthcare impact of the pandemic. And this is Dr. Rajani Patwari. And Dr. Patwari is the medical director of Trinity Services that provides support to over 6,000 men, women, and children who have been diagnosed with developmental disability or mental illness. Prior to her time with Trinity, Dr. Patwari was medical director at the Elizabeth Ludman Center in Park Forest for over 30 years. Dr. Patwari has a long association from the 1970s with the Vedanta Society and is still an active member. Dr. Patwari, please.
नहीं ठीक है ना यहाँ पे हाँ Yeah. Hello. Yeah, I think they had to make special arrangements for me. I'm so sorry about that. I really didn't mind if you don't see me as long as you can hear me, so it was okay. But my name is Dr. Rajani Patwari, and he already introduced me. And I am supposed to talk the impact of COVID on the healthcare system. We already know about what happens in economy, but what happens in our healthcare, because that is our most concern. Everybody is concerned about their own health. No matter what happens to the rest of the world, but I should be okay. I should have in good health. That's what. So before doing this, I really request everyone to wear a mask, unless you are talking or playing or eating. So this is my humble request. This is not only for your own sake, others' sake, and for everyone. So please make sure that everyone wears a mask, because we take it very casually, because I work in the healthcare, I see the effects. What happened. If you go in the parties and the groups like this, you may not see much. But when it comes to the health, it really hurts. It hurts a lot. Because if you have seen, you will never go that route. So today I'm supposed to talk on impact of COVID on healthcare. So before going further, I really don't have any slides or anything. I am the slide, So please pay attention. That's what I would like to have you. So what is COVID? First of all, we need to know the basic. You have to get the roots out. Then only we can go further. So COVID is called SARS-CoV. It's the full name, because whenever you go and do the test, the lab test, and when you get the result back, it says SARS, because that is a virus, SARS-CoV. And why 19? Everybody says COVID-19, COVID-19. What does 19 mean? It is, argumentative. I'm not going to go too much into that, but supposed to be discovered in December of 2019 in China. If you believe, if you don't believe, I'm not going into that argument. But that's what it is. And it spreads person to person. We know that, that's why we take all the precautions and, all the things. Now, before going further, we really need to know the basic, like I said, what is a virus and what is a bacteria? What is the difference between that? When we go to a physician, they give you antibiotics when you have bacterial infection, not for the virus. Why it's like that? The reason is, first of all, there is a difference in the size. Bacteria are much more larger than the virus. Virus are very minute things. And another thing with the bacteria, they are the free living cells, because they can survive outside our body and they can survive inside our bodies. But viruses can't. Viruses needs a host to survive. That's why they spread. And that's why, we say incubation period, how long they can survive outside, and how it can travel from person. It has to travel from person to person, because it has to have that host, to grow, to multiply and cause the symptoms, which bacteria doesn't. And bacteria are not always very bad. Bacteria, there are good bacteria and there are bad bacteria. If we look into the microscope outside, everywhere there are bacteria. But doesn't mean that they infect us. Okay? And what is a virus? Like I said, it is very smaller in size compared to bacteria, and they are non-living cells. Non-living cells, they are just a collection of molecules, and they are covered. There is a covering over the bacteria where their DNA and RNAs are. That's why we see in the COVID this mutation process. By the time we think, we are out of COVID, some other mutation comes. We have been experiencing it for last, few years. And that was, and another thing is, antibiotics does not penetrate that wall. That's why you cannot kill the virus. That's why they say, in virus infections, the physician never gives an antibiotic, because it is useless, It will take its own time to clear. So that's why they say antibiotics are not, good. The second stage, what we need to know, we are always hearing pandemic, but we really need to know what is pandemic. Why it is called pandemic? And pandemic, epidemic, and endemic. These are the three stages. So what is the pandemic when? This all depends on the rate of the growth of the virus. That's how they have been divided. Okay, pandemic means when the disease growth is exponential. It grows very fast, it skyrockets. That's what we saw with the COVID, all of a sudden the whole country is wiped off, with the COVID, and it affects, and it not only affects the countries, but it crosses the border and goes into another country. So it is worldwide or universal. Whenever the infection crosses the boundaries, goes from one country to other country to other countries, it is called pandemic. Because by the time you cannot contain the infection at one place or one country or one state, but it goes all over. That's why we see, started with China, USA, UK, Japan, India, everywhere. That's why then it spreads like a fire. That's why it is called pandemic. Epidemic, when epidemic we call when it spreads. The unexpected increase of the infection, but in some geographical areas. It doesn't go pandemic all over the world, It goes in some states or some places or some cities or, something like that. That's why it is called epidemic. Example of the epidemic is yellow fever, when it starts, and then the smallpox, measles. That's why we have come up with all these vaccines and things like that. So this is called epidemic. The third one is called endemic. We know those who travel internationally, we go and ask the physician, do I need any vaccine? I'm going to this and this and this country or this place. So there are pockets. There are pockets of, different places where the certain bacteria or viruses are very common and they affect you and you get infected. And you can see, this is predictable. See, in India, because I'm from India, I can tell you, when we go to India, in certain places they tell you, malaria is very common. You better take the vaccination of malaria over there, or typhoid is very common. Take the typhoid injections, or hepatitis is common. Take the vaccine, then you are protected. So these are the pockets. In different, it could be anywhere. So those are called endemics. The thing endemic is because it is never wiped out. They never become immune for the whole thing. There will be a rate of infection will still be there. So, in short, what we say, pandemic is international, okay? Epidemic is regional, okay? And endemic are the pockets. If you remember this, then you will know the difference, why we are so worried and we are worried about all these pandemics. Traveling, why all the airlines have been blocked. Some countries have been blocked going to, they won't let anybody coming from other country because of this pandemic reason. It can grow, it can spread, it can cross the limit and go to the other countries. Now, why we are so worried about this COVID-19 pandemic? Because in our lifetime, this is the first disaster we are seeing. But in general, if you look into, there have been multiple pandemics in the past, which we did not experience much. That's why we don't know the effects of the pandemic. Just for example, in 14th century, how it came, so it gives us some idea. 14th century, it is called Black Death. It is called Black Death, and 25 million people were killed. I am talking about 14th century. They were killed, and it's also called like bubonic plague that lasted for 4 years. People were killed. Slowly and slowly people get wiser. You go into research, start the vaccine, and then vaccinate, and slowly it gets wiped off. But this is the 14th century. Then in 16th century, smallpox was a pandemic. Even lot of us may remember, when we were in school or young or whatever, how we got this vaccination of smallpox. So smallpox is especially, and it is said that smallpox started in Europe. True or false, I don't know, but this is what it is said, that it started in Europe and then America was wiped off, and it is called American plague during the similar time. and no matter what you do, people are being killed and died, we couldn't do anything about it. 2 civilizations were wiped out because of this American plague. They could not contain it, they could not control it, they could not cure it, and they could not treat it. This is what happened. Then 90% of the Western Hemisphere was killed at that time. This is what it is said. In 1889, these are before our times, of course. In 1889 and 90, first emergence of flu. Now, we don't think much about flu. Oh, just common cold, this and that. I'll be sick for 2-3 days, I'll stay home, stay in bed and get up and go to work. That was not the condition that time. So many people died due to flu, and they say this flu started in Russia. In Russia, the flu was started and 1 million people were dead at that time. So this is nothing new really for the civilization. For us, maybe new. Then, another big pandemic is 1918 to 1920. And this started after World War I. At that time, that was also called Spanish flu. These are all viruses. Spanish flu, and 50 million people were dead in 2 years. So compare this with whatever happening with pandemic now. Okay. Then 57 and 58 we know kind of. These are the times at least we are aware of. Asian flu, avian flu, all this began again in China. That's what is documented. Okay. I cannot prove anything. 1 million people were dead. So people are dying right and left, and 116,000 nationally here in USA died at that time. Okay. Then we know that this is in our times. In pandemic, AIDS started. AIDS became pandemic. Nobody knew what to do with AIDS. It was spreading like crazy too. And then it became a pandemic. And also later on, when we started having precautions and how to protect yourself and the vaccine, then it became an epidemic and endemic. Now started the COVID. We come to COVID now. COVID, like I said, it is a virus. It is a virus, and the speciality of the virus is virus has a capacity to mutate. By the time we think, oh, it is coming under the control, another mutation comes. We have seen this. From 19 December to 20 and 21 and now 22. We are in 22. Still we are worried, and you don't know. It is so unpredictable which mutation is going to come and what going to affect. So that's why it is so scary right now. Okay, so we know 19 it is called because it's supposed to start in China, and it started, the first case noted was in China in December of 2019. So the name came COVID-19. So that's how it says. Okay, death rate at that time, in Illinois itself, forget about the other states, 3.76 million people were dead. Because this is so new, we don't even know how to react. And there was no time. Before you know, the person is dead. This is what, happened. Hospitalizations, that was another thing, because people become so paranoid. Once somebody just sneeze or cough, people get paranoid. Oh my God, maybe the person has a COVID. You become paranoid like that, and then slowly what happened, people getting aware of it, you develop the policies, public health, CDC, WHO, everyone has to get involved because of the pandemic thing. So 9.8 million, it dropped to 9.8 million when vaccination started. But again, there was so much controversy about the vaccination. Not everybody is concerned, and we know in USA, human rights is a major thing. So everyone has a right to refuse. So a lot of people don't believe in vaccine and don't want to take any vaccine. And when you are full vaccinated, now every 6 months the new vaccine and new booster is coming. And people are going crazy, with that one because of the mutation. This is what is happening with this. Now, everyone has a big question in their mind, when will it end or will it end? In my lifetime, is it going to end or not? It is said that China doesn't have any cases from July. So they don't have 0 cases. Okay. In USA, what we experience is the severity is less. Severity is less because people are getting sick, they are getting infected, they are getting positive. But, you don't have to get admitted to the hospital and things like that, and hardly people are not dying unless you are immunocompromised, you are geriatric, or you have other medical problems. But normal, young, healthy person, has a good chance. That's what it said. Now, the variants, because viruses are smarter than human beings. Because by the time we get to know them, what kind of virus it is, they mutate. They change their face. And a new thing comes up, alpha virus, beta virus, then delta virus, and now Omicron virus, and there are mutations in Omicron too. It is BA1, 2, 3, 4, and that's why every so many months we get a new mutation, and again we are on square one. That's what is happening. So we have to see that how do we get out of this? Even though the cases are, and human beings are like that, even the severity is little less, people all of a sudden jump into their normal life. I don't care, I want my normal life. What is normal? What we think is normal. But what we have to do, there is, and they have sort of, CDC said that, Public Health said it, WHO said that, everyone is after this one. Manufacturing the vaccines and things, and they are saying prevention is the only key. The treatment is what we do is after, you get infected and when you have symptoms and things like that. So, but we see that there is good awareness in the population, general population, in the public, and knowledge. A lot of people know a lot about the COVID and the infection and all that thing. Then people are also making the plans. The public health is making plans. The companies are making plans. The hospitals are making plans. Short-term plans, long-term plans. Because people started thinking it is very taxing. Because what we go through, our organization, very, very taxing. Because we serve so many people, so much staff, and it's very difficult to get the information to the root of the people. And so that they realize and understand. And vaccination is the key, everybody says that, but we cannot convince everybody, and keep track of that vaccination. There are apps, there are so many things the government has, developed, but in spite of that, people are not as aware as, Another thing is, lot of people has changed, or the economy has changed. We already heard about the economy, how it is affecting. It is called home-based modules. Because what happened was, whenever people, in the initial stages, when people will get infected, everybody will run to the hospital. And the hospital was loaded with patients. And they didn't know what to do with it. So what they started, they put the tents outside, the emergency rooms. There are the tents, and because what is happening, people who are infected, they are infecting the sick people in the hospital. And that is what causing a lot of problem and lot of deaths because of that, Now, there is a big unknown. Every time the new vaccination, and even at this time, we are not sure we are done with the vaccination or not, or the new mutation will come, the new vaccine will come, again it will be the same thing. Now, we come to the point of impact of this on the healthcare. People may not realize, the reason I say everyone to wear mask, because you may not realize what healthcare is suffering with this COVID and with these infections, There are some positive impacts and some negative impacts too. So I'll go with the negative impacts first, Here, average admissions to the hospital increased by 39% due to COVID. Because initially, it right away went into the seriousness. You need the ventilator, you need the oxygen, all that. But in spite of that, people were dying. Okay, the average admission increased by 39%, and all the hospitals worked or operated under what they call as a red zone. because it was very, very difficult, and most of the people affected are the frontline people, which other people outside in the community may not realize it. People in the emergency room, the nurses, the doctors, the other people who are serving, everyone affected so badly, because they are all frontline people in there, So now, the hospital and the healthcare are frontline life, because they are the frontline fighters. Everyone wants to be nice, and everyone thinks I should get admitted to the hospital, and I should be treated first. But there are sicker people, so that got affected. The people who are really sick are pushed back, and the death rate increased because of that too. Okay, so what happened? Because it is what is called stress, so much stress created on the hospital staff. So people, what they did, they lost lot of very critical staff. Then who is going to take care of the patients? People are working so many hours, they have to work with the PPEs, just try. We are having problem just wearing a mask, and here in the hospital, look how PPE is. If you wear the whole thing and work 18 hours, 20 hours, you will be half dead by the time you get out. So you can realize that, and you can say that. So slow recovery started showing in 2020, and intense pressure, but this really created intense pressure on all the hospitals. Intense pressure, and organizations too, especially nursing homes and other organizations where you come across with COVID. And there is a low staff, low resistance, low revenue, because there is no revenue. The hospitals are, on verge of closing, and more hospital close, then more patient care is affected. See, that's what is happening. So if you understand, total loss of hospital over this period is $323 million. You can imagine. How do you survive? $323 million hospitals lost, and 4 dozens or more hospitals closed. They could not survive. No money, no revenue. As he mentioned in economy, no revenue. The hospitals could not survive. And apart from this, what happens to general population? General population affected too, their healthcare affected. Even the routine healthcare, those who are having heart problem, asthma problem, any other problem, their routine follow-ups are affected. They are not being seen. That's why they are being affected in general population too. Then also, this caused a very hike into the mental health care, because people could not tolerate that. Depression went high, skyrocketing. Then anxiety skyrocketing, because people are not used to staying home and taking all these limitations, so they could not tolerate it. So this all mental health care started, going up. And can you imagine what happened to the schools? Children, they don't understand why the schools are closed. I have to stay home, and suppose somebody is infected, then you have to be quarantined. They don't know what quarantine means. So the depression and anxiety in the children also increased. Schools were closed. All this mental health care was really got very, very bad. So the kids who are staying home, they don't, 2 years, 3 years, 4 years, they don't understand anything. Why I should be locked up in a room, in a quarantine? You cannot explain to a child. So this really affected our mental health system too. And that's why anxiety and depression is very, very high. Now, the last point I want to make it, there are some positive points too. The pandemic causes a lot of good things. Number 1, telehealth. Telehealth increased so much. People can do. Then a lot of people started working from home. And now they are getting so used to working from home, nobody wants to go to work. It is so nice, just stay home in your own environment. You don't have to dress up, you don't have to do anything, just stay home and work. Work from home. Production can be increased, but people abuse the system too, and go other way around too. So that's what happened. That's why all the meetings, all the things are going into what? Zoom. go to a meeting, those kind of things, So the technology is increased so much that, people benefited with that. We cannot deny that. The second thing, here is, they said, awareness in the community, because there were a lot of things, we started to make aware the people, the different organizations, different offices, different, hospitals. They started these programs of awareness. How to make people aware, what you should do and what you should not do, for those kind of things. Another thing started recently. It has not come into practice yet, but it is called home hospitals. Because we cannot take people in the hospital. So we came, if you remember, this is used to happen many years ago, decades ago. The physician used to come to your house to check you. You didn't have to go. That we lost in between. And now, the physician comes and all the hospital care which you used to get, because this is much cheaper and convenient to the physician, to the patient, to the hospitals. They will give you everything at home. They will give you oxygen, they will give you ventilator, the physician or the nurse or whoever will come home and check you and keep you away. So that way you are protecting the patients in the hospital who are really sick and they need care. So that has coming up, and people also, what I noticed, I can just talk, I don't know whether it's true or not. People learned how to help others, that spirit started coming up. I think Swamiji will talk about that in the spirituality. But helping each other, that is one thing. Second thing is, people are learning to live within their means. Before, what we used to think, I must have it. But now I can get, without it. Learn, what really you need to live. That was one thing. The second thing was, the people didn't care how you look. Now you wear a mask, you don't even know, you can't recognize person. You are smiling or not smiling or angry or not, we don't know anything. People don't care, I want to be safe. That's why, they don't care for, that. And the ultimate point, then how do we do this? How do we look into this? Is the prevention. In prevention, in medicine, we were taught this way, okay? You follow universal precautions. What universal precautions means, you think and you feel each and everyone is infected. And you behave that way. That is called universal precautions. Everyone is infected. Not only when you are positive, I know, and no, not like that. Think everyone. So in different organizations, hospitals, nursing homes, we follow universal precautions. Think everyone is infected. That is what called universal precaution. Second thing is hand washing. We cannot emphasize that. How much hand washing is important, because you look your hand under the microscope, you will be surprised to see the whole hand is full of bacteria in them. So hand washing in hospitals, organizations, you go in the prevention part, the first thing they teach you is the hand washing. Hand wash your hands as many times as possible. That is the only way. The third, and sanitize, of course. Hand wash and sanitize. Not over sanitization has its own rules too. It is taught in the nursing schools and the medical schools too, that you can sanitize not all the time because it is easy. Nothing compares to washing hand under flowing water with soap and water. That is the best. But we are not, it is not available all the time. That is the time you have to use sanitizer. Why? Because if you look at the sanitizers, that liquid, and if you try to wipe few times, it creates a layer over your hands. That's why you have to clean it, wash it with flowing water and soap. Nothing like that. Nothing compares to that one. Then, we were taught since we were young, when you sneeze and when you cough, cover your mouth. Why? Because there's bacteria in this, and this is a respiratory virus that goes. When you cough, that's why people are so paranoid. When somebody coughs, oh, maybe the person has, or sneeze, because they spread through that one. That's why. Then maintain the social distancing, even otherwise. I am not saying that this is only for the COVID virus, but even otherwise, social distancing, because we know that gatherings is very important in our life. Okay, at that time, more the merrier, that's what we call. But if we follow the social distancing, it is given. Even CDC has emphasized that. Public health has emphasized that. Everywhere you go outside, there are marks. You stand there, you stand there, you stand there, 6 feet distance, because virus cannot cross that line. That is why there is a social. And last but not the least is wearing the mask. I don't know how more and how to emphasize that, wearing the mask, and don't think that if you wear a mask means you are 100% safe. No. Even with that you can get infected, but the chances are much less. And get vaccinated as many times as possible. Do not turn away from vaccination. That is our only hope at this time. We are not out of woods yet. Because at my organization, I can talk about, we are still getting positive cases. Good thing is not as severe as it used to be. Because before, virus, pandemic, infected means dead. And lot of us have heard, especially in India and even here too, that you are not allowed to go and see your relative in the hospital or anywhere, because you are not one person or not at all. You cannot even see that body again. We have gone through that one, but we are lucky enough to have the vaccination. So I think these are the major healthcare, and still I feel that we are not out of it yet. And I want to thank Swamiji, I want to thank the center and giving me this opportunity to put my thoughts in front of you. And I hope you guys, it is some way beneficial to you people. Thank you.